Hi, I'm Susan Ritchie, and I'm a professional officer in the Office of Social Services in the Department of Health. And I'd like to thank everyone for coming along today. We're really delighted with the interest in the new policy. So just before we start, for some reason, Alison, this isn't moving for me. Sorry. Of course, this was what happens then whenever that's it now. Thank you. Just before we start, just wanted to go over the programme for today. There's going to be the opening from Aine Morrison, the Chief Social Work Officer, followed by myself, Dr. Paula McFadden, Maria Emilsson, and Marion O'Rourke. We aim to finish today sometime between 1:15 and 1:30. You'll see there's no question and answer session built in today's seminar. Instead, what I'm going to ask you to do is take any of your queries back to your organisation, and they can be addressed during your awareness sessions that will be delivered in your organisation. So I'd like to hand you over to Aine Morrison, who's our Chief Social Work Officer in the department, who will talk to us about the importance of supervision in social work and explain the evolution of this 2024 social work supervision policy.
Thank you very much, Susan, and thanks to you all. It's really encouraging to see so many people here and the level of interest in this. I'm delighted, and I mean that, to be able to launch today's policy. Although I would say I'm probably not quite as delighted as some of you who have been on this rather long journey, and more of that later. But you know, it's key to social work that we have a robust supervision policy in place that promotes quality supervision and supports social work practitioners in their role. And you know, in the current trying climate of many pressures, you know, supervision is not the thing that should go, because it's absolutely crucial in supporting social workers. And I'm sure some of you were at a domestic violence conference with me in Dundalk yesterday. And it was funny, in terms of supporting social workers to deal with, you know, kind of trauma, the emotional impact on them, the holding of risk in relation around to domestic abuse. So supervision was up there, you know, in all the presentations about being really crucial. So this policy applies to all social workers in trusts and in the Children's Court Guardian Agency for Northern Ireland as well. However, we have been engaging with other statutory sector and CMV sector about the policy, and we certainly are recommending that any organisation that is employing social workers should use it, and I will be sending letters out to that effect shortly. So why is supervision important? So I think it's about a number of things. Social workers need regular supervision to develop their skills, to maintain their standards of practice, to support the professional development of, you know, of that social worker. Big one, to maintain well-being. Also, I suppose, to accompany a social worker along their professional journey and developing that confidence and competence in their role. And it's important at all stages of career, but it's particularly important, I think, for our AYEs or people moving into a new role. You know, because, you know, all of us have to develop in the role that we have. And I suppose I should say, I probably should have said this first, fundamentally it's about improving the service that we offer and the outcomes that we make possible for the people we support. So it's really important that organisations embrace the importance of supervision, and that supervisees and supervisors work jointly to ensure that quality supervision takes place regularly. So at a later stage in the seminar, Paula McFadden is going to share further research in relation to supervision. And within the supervision policy, we reference Sky research, which indicates that sort of good quality regular supervision can reduce staff turnover, improve worker effectiveness, and works best when there is a positive relationship between the supervisor and the supervisee. It also works best when it provides the opportunities for reflection. It also is really important that expert knowledge is shared. And as I've said already, that ultimately the aim of this is not just to develop us all nicely. It's about improving what we do. So key to good quality supervision is the role of the supervisor. And, you know, those roles and and I suppose the importance of kind of all line manager roles, but in particular, I would pull out that first line manager role as being really important. And I think it's that supervision of you know, frontline practitioners that's really, really important. It is a highly responsible one. And the supervisor needs to have strong social work skills, knowledge, values, expertise. So supervisors should be working on developing a very positive, a reflective, and a developmental relationship with the supervisee to provide direction, guidance, and support, but also promote independent decision-making, professional autonomy, confidence, etc. as well. So, you know, I'm not saying any of this is easy. So, you know, but so there's a balance to be found in that. Promote the use of up-to-date knowledge and research to promote best practice. Enabling that kind of reflection, learning, development, modeling and adhering to social work values, attitudes, and behaviours, and I've always believed that to be a really important bit of, I suppose, leadership within social work, which is that, you know, that those of us in these positions, that we're modeling the sorts of values and attitudes and approach, and that's very present when you're talking through maybe a particular case. So that modeling role is something that I think is particularly important. And as I've said earlier, just the emotional support and the impact on the social worker's well-being, that's a key element of supervision as well. So I sort of alluded to this earlier, but just to provide you with some background context to the new policy. So a key priority of the social work strategy was to strengthen the capacity and capability of the workforce. And at that time, there was a sense that the existing social work supervision policy wasn't cutting it exactly in terms of what was needed about social work practice. There were two regional surveys of supervision and social work, one in 2018 and one in 2019. I'll come to a little bit more detail on those later. In 2019, the regional working groups developed a draft policy and guidance. And it's really important for me to say that many of those involved in those groups are present today. And I really genuinely want to stress my appreciation of all the work that has gone into this. It's been a long, hard slog. People have been very committed to it and very committed to getting it right, and that is very much appreciated. Then we had COVID, of course, and policy development was probably far from most of us in terms of our minds. Although, having said that, at a stage during COVID, we did pilot the draft policy across various sites in trusts to provide assurance that policy recommendations would be effective, fit for purpose. And the learning from those pilots was then included in what we have today. I do want to also acknowledge Susan's work in this. Susan isn't very long in the Office of Social Services, and certainly when we sat down at the very beginning, I was like, one of the priorities is to get this finished and out there, and you know, and supporting social workers in their practice. And I think Susan's just about recovered from the process. She'll probably be better after today, but
Yes.
but I think we can all acknowledge that actually Susan's part was really important in getting over those final hurdles. And I also think I think what we have is more readable than previous drafts, more attractive, more accessible, and therefore I hope more likely to be used effectively. So big thanks to Susan. I'm sorry, I should say as well, because Susan's worked very hard with the ADs on this over the last couple of months as well to get over the final hurdle. So really grateful for that as well. So the two surveys, what did they tell us? They give us a lot of intelligence and evidence about supervision practice. They definitely informed what we have today. And I think the key messages were about the challenge of adequately covering all the functions of supervision by relying only on one-to-one line management supervision. It's a strong message that services should be able to adapt supervision methods to suit their service requirements. Also that, you know, the importance of recognizing and acknowledging that social workers learn from their peers and that they thrive in a team environment. So group learning approaches should be utilized more often. There was a big message about, you know, the skill and the expertise that's required to do supervision well, and therefore an acknowledgement for training and support for supervisors. And then there was also a message about making sure that we had feedback loops in terms of, is supervision working? Is it meeting the practitioner needs? Is it meeting the supervisor needs as well? So that, you know, this was a sort of continual process of developing the supervisory relationship. So hopefully what we have now has taken on board all of the things I've just talked about. I think one of the important things is that this is a flexible approach, and we have worked hard to build flexibility into it, and to allow, you know, I suppose a sharing of expertise and using that to support people's development, using the team, and I suppose relying on kind of professional judgment about what works in a particular setting and on what doesn't. I should say that it's not entirely flexible because the department did feel that it was important to set some standards for what the expectations were about supervision, and that's very much about believing that it is really important that social workers know what to expect from supervision. They know they're going to get it. They know what it's going to look like, and also that they know it's valued. So flexible, but with a few key messages in there as well. So I'm going to hand back to Susan, who is going to give a bit more detail on what's actually in this new document.
Thank you very much, Anya. So Anya's provided the context of the supervision policy, and I'm going to provide an outline of the content and what the policy may mean for you as a supervisee or a supervisor. Now, it's going to be a very quick overview, and you'll learn more about the policy in your organisational awareness sessions. So the starting point for the policy was identifying the underpinning principles and values. There are actually more than this in the actual policy, but these are some of the key messages we wanted to send. That all social workers receive monthly supervision, that newly qualified supervision meets AYE requirements, that social workers who are line managed by a different discipline also receive professional social work supervision 4 times a year. All staff who provide supervision should be trained, and that supervision is a collective responsibility by all parties who are involved. Supervision supports reflection, and professional development and the application of values. It also supports the application of knowledge, evidence to improve practice, and it also recognises the emotional impact that the role can have. Group supervision can enhance the learning component of supervision, and professional consultations to discuss complex casework could also be considered as a form of supervision. So they were some of our starting values and principles, and I'll refer back to some of those later on as I go through the policy. So the policy has three core functions, and they're all interdependent and they all overlap. So all supervision functions, the professional, the organisational and the personal functions must all be met, but they can be met using different methods of supervision in order to do so. Well, there's a lot on this screen, but this is just breaking down the organisational function. So this is the function of supervision that focuses on case discussions, casework decision, risk management, compliance with statutory functions, legislation, policy, etc. It's where the supervisor provides direction, sets standards of practice, and when required to, provides an evidence base and guidance to support decision making. It's not a standalone function, but it interlinks with professional development and the personal well-being functions. So for example, if you're having a reflective discussion concerning casework and decision making, at the same time, you can talk about the impact on well-being and talk reflectively about that case and what is impacting on your decision making if there's an evidence base. So that way you're sort of crossing all three functions. The organisational function will primarily be met through one-to-one supervision with a line manager. However, professional consultation with a principal or senior social work practitioner to discuss and reflect on a complex casework may also meet the organisational function, and I'll go into that in further detail as well. So the second function of supervision is professional development, and this is the learning component of supervision, and it's integral to developing competent and confident practitioners. Reflective discussions are how we learn and improve our practice, and a key message of the policy is that individual supervision should always use any opportunities to reflect on practice and address the professional development function. However, it is recognised that individual supervision is dominated by the organisational function that I've just talked about. And that can place limits on how much the professional development function is addressed in individual supervision. So the policy outlines a menu of group supervision methods that can be used alongside or in place of individual supervision at 4 points in the year to enhance this professional development function. The third function of supervision is personal well-being, and it must be explored in individual supervision. And where a social worker experiences a role-related violent incident or the role is having a detrimental impact on well-being, it must be discussed in individual supervision. And if applicable, an incident debrief or personal impact assessment can be offered. Risk management plan and safe working practices can be reviewed. Organisational processes in relation to well-being followed, and a practitioner well-being and support plan put in place and reviewed. And that also could give an opportunity for wider lessons for the service. So what are the key messages of the policy about these three functions? All three functions of supervision must be met, and where possible, individual supervision should address those three functions. The organisational function will primarily be met through individual supervision by a line manager with operational responsibility, but professional consultation with a principal or senior social work practitioner to discuss and reflect on complex casework may be considered as a form of supervision to support that organisational function and aspects of professional development. The professional development function should be addressed in individual supervision, but as individual supervision tends to prioritise the organisational function, professional development can be strengthened and enhanced through group supervision methods. Personal well-being should always be explored in individual supervision, And introducing a mixed method approach to supervision delivery can strengthen all the three functions of supervision that I've talked about. So here are some examples of how a service might use this mixed method approach that I've talked about. So you could find that in a service, individual monthly supervision takes place that meets all three functions of supervision, and they decide that no other methods of supervision are required, and they're satisfied that individual supervision meets those functions. Or up to 4 times in a year, individual supervision is replaced with group supervision that primarily focuses on supporting professional development function, and or professional consultations with a principal or senior social work practitioner to discuss and reflect on complex casework. And they can be on an individual basis or in small groups. So it can be a mixed batch of that. You know, you could find that 4 times in the year, one could be group supervision. You could have 3 professional consultations. You could have 4 group supervision sessions, or you could have 2 and 2. So it's using that mixed method approach in order to support those functions. And we have another one, and that is that individual supervision still takes place monthly. But in addition, a service may decide to add in opportunities to do group work and also professional consultations, and that they're available to supervisees throughout the year as an addition to monthly supervision. Okay, so I've referred to the mixed menu of supervision methods. So let me just go over what they are. The first one is individual supervision, and that will continue for everybody. And the policy sets a range of standards, as Anya had mentioned earlier, in terms of individual supervision. The majority of your individual supervision will be with your line manager. Most of them are in person, but some of them may be online. In the unavoidable absence of a line manager, a senior social work practitioner who's trained in supervision can supervise social workers as a temporary basis. Individual supervision should be typed, shared, and signed by both parties within 10 working days. And there may be times, though, when frequency of individual supervision is increased that will help meet or address a supervisee's needs. Case decisions made in supervision should always be recorded, and we've made an allowance for the fact that there will be that move to encompass for most folk in the coming months, years, and that should be recorded on the digital record. And I suppose until that's not available for folk, that's still on, then that should be recorded on the service user record. But as we've said, up to 4 times a year, individual monthly line manager supervision can be replaced by professional consultation or a range of group work supervision methods. So what's a professional consultation? The purpose of it is to discuss and reflect on complex casework. And where professional consultation is used to replace individual line manager supervision, there must be a supervision record of that consultation that's kept within a supervision file. Any case decisions made during that consultation should be recorded on the record, but also discussed with the line manager who holds professional responsibility. And consultations can take place on an individual basis or in a small group. The arrangement for professional consultation should be recorded on a service supervision plan and recorded in an individual learning agreement. And I'll talk a little bit more about service supervision plans and individual learning agreements. So I'm not going to go into the detail. The supervision policy outlines all the different methods of group supervision and what they might look like. And Maria is going to talk a little bit more about group and peer supervision in her presentation. But the key messages are that it requires a qualified social worker with relevant training and experience to deliver, but it doesn't have to be a line manager who delivers group supervision. They work best when they're in person, and they should support the professional development function of supervision. However, any decisions made around casework should always go back through the line manager with operational responsibility for agreement. And you'll see in the policy itself, there's a lot of detail in terms of what each what each group supervision method should look like in terms of process, recording, and standards. So professional supervision in multidisciplinary settings is important to consider as well. You know, where a social worker receives monthly supervision from a line manager from a different discipline, arrangements must be in place for professional supervision from a professional supervisor who's social work qualified. Also included that in that second point is, so for example, if you've got someone in a post that you need a professional qualification for, so a nurse or an occupational therapist could have applied for it, but you're holding a social work qualification, then you also will require professional social work supervision 4 times a year. The policy itself goes into a lot of detail around the role of the professional supervisor and sets a range of standards that would be expected where professional supervision is delivered in this setting. But the key points are that it's 4 times annually as a minimum standard, that they ideally take place in person, and that there's an annual tripartite between the line manager, the supervisee, and the professional supervisor so that everybody's clear on roles and responsibilities and that lines of communication are working. Newly qualified social workers in the supervision policy look specifically at newly qualified supervision or social workers and their supervision. And the research is indicating to us that the first 2 years in post are really key for learning and support, that individual supervision arrangements must remain in place around AYE and their NISC requirements, but the providing group supervision and peer interaction in addition can also support newly qualified social workers develop their professional competence and confidence. So really what the policy is suggesting is where possible, that newly qualified should be provided with an opportunity to learn from their peers, and group supervision is provided if possible. So there's a lot of information on that slide, but there are some quotes from a recent AYE audit in terms of what AYE social workers said about the importance of supervision. And I think that's really, really valuable information for us. What we're seeing is that working in close proximity to colleagues and managers really positively impacts on newly qualified social workers, their quality of practice, and really improves their motivation to stay in the profession. Regular access to and interaction with peers really helps newly qualified social workers develop and enhance their confidence and their competence in decision making. Peer support, advice, and guidance is beneficial to newly qualified social workers in both the immediate and longer terms. And supervisors and managers should demonstrate and model compassion, encouragement, and a reflective learning culture in their interactions with newly qualified social workers, because really what they're saying to us that's one of the most important aspects as they move into their new roles. Okay, so in terms of, I'm very conscious of time and I'm coming up to due to my time to finish. I've only a few more slides to do, but in terms of assuring quality supervision, the policy outlines different ways that we can do that. And the first one is service supervision plans. So a service supervision plan, you'll start to hear that language being used more and more. And that really is where a service outlines the methods of supervision that they're going to be using in order to meet the functions of supervision. It's going to identify who will deliver those different methods if they're going to be used. And it should be completed by a senior manager. It also identifies all the training needs that are required within the service as well. So the supervision agreement then is a contract between a supervisor and a supervisee, and it outlines the supervision arrangements for each social worker. It must refer to the supervision plan. So if you need to know as a practitioner if within your service you're going to be receiving monthly, if you're going to be receiving group supervision, or it's okay to do consultations with a senior or principal practitioner to replace supervision at points in the year, and that should be written into your supervision agreement. So it's really, really key that service supervision plans are completed and that they feed into supervision agreements so that every social worker is clear on what their arrangements are for their supervision. And so annually, each organisation will audit the supervision 7 key standards. The policy itself goes into much more detail in terms of what's required under each standard. But this will assure that this will assure the organisation that supervision is taking place in keeping with the policy. Where it's not, improvement plans should be developed. And in most organisations, that's usually led by a social work governance lead. We have other ways of assuring quality supervision, and that can be about ongoing evaluation between a supervisor and a supervisee. And what we're asking is that twice a year, there's a conversation takes place that reflects on whether supervision is working for the supervisor and supervisee, and that is recorded. And another way of assuring quality supervision, of course, is ensuring that our line managers are supervised themselves and that line managers get the opportunity to reflect on their own supervision experience. In terms of training, sorry, I could hear somebody talking. In terms of training then, there's a whole list of the training that really needs to be required, because it's really key that we're assured that those who deliver supervision are skilled, and that those who also are in receipt of supervision understand its importance. So we continue with the course that is currently run and delivered in trusts, which is completed in the first 6 months for new line managers. Existing supervisors and team leaders who have already done that programme don't need to repeat the programme, but we're asking that awareness raising takes place within organisations, so they become familiar with the supervision policy. There also will be modules attached to that initial training, and that might be around group supervision, reflective supervision, and the policy outlines that. And we're asking that where anybody is involved in delivering the likes of group supervision, that they complete those modules. Currently, there's been developed an e-learning supervisee training module, and that's process of being developed, and Maria, who's going to speak later, has actually been involved in that, as has been the regional training group in developing that. What we want to move to is that everybody completes that e-learning and understands what supervision is for, the purpose of it, and the policy. Think family e-learning for supervisors. There's a module that can be completed by children's and mental health managers. So we think that would be really useful to embed family focused discussions into supervision, particularly in those programs. Service managers are responsible for ensuring supervision training is completed in their service, and they should annually review that as part of the service supervision plan. And there's a section in that specifically looks at training needs. We've suggested that ongoing support needs for supervisors is reviewed within organisations, and also for organisations to consider what other disciplines who line manage social work staff need to know about this policy. Certainly where there's a role for senior principal practitioners to support the delivery of individual or group supervision, they should be trained. And we're also encouraging that supervisors and supervisees gain recognition within the NISC PIP framework for any supervision training that they complete. So that's been a really whirlwind move through the new policy. And I really hope that it's been useful for you to hear. And as I've said, you'll get the opportunity to attend awareness sessions and talk to people within your own organisations in terms of moving forward. But I suppose a key message I just want to leave you with is that the new policy holds to a very clear set of supervision standards, principles and functions, but it provides a flexible approach to arrangements designed to allow a service and its team to plan a model of supervision that will work best within their setting. Okay, so thank you. I'm going to hand you over now to Dr. Paula McFadden.
Thank you, Sue. And you'll move the slides for me?
Yeah, I'll move the slides for you, yes.
Hello, everybody. So I'm just going to take you through a few slides on what the research says about supervision. in particular drawn from a recent systematic review of the literature, identifying something like 27 papers talking about reflective supervision and its role. So if you want to move to the next slide there, Susan.
I'm trying to, for some reason it won't move. For some reason this happens.
Hmm.
Oh, there it is now.
There we go. There we go. So this is just the context in terms of the regulatory standards and requirements around supervision, and citing both the Social Care Council here and Social Work England. And the emphasis is about supporting social workers and their professional requirements and standards. But also it's about the role of social work and the responsibilities, and as well as that, it's about the impact on social workers' well-being at work, which is a really critical thing that I think this current new policy is addressing as well. Next slide, please, Susan. Okay. All right. So what we found is that there was no definitive definition of what reflective supervision is. You know, there's a lot of different uses of the terminology, and so it was just interesting to see like what is available and what do we need more about, and we do need to maybe consider this in a wee bit more detail, because reflective supervision is about that more in-depth professional accounts of practice in a structured supervision session. Next slide, please, Susan. And our Stan Houston developed this reflective practice model back a few years ago, which provided us with the information to pause, or the evidence about pausing to think about a person's psychobiography in the context of their practice. And that's their practice directly with service users, but also within the supervision session, really highlighting that everybody brings with them their own background in terms of their psychological life experience, their political and economic circumstances, the culture in which that they have come from. And, you know, it offers us an opportunity to really think about the core differences and people coming at things from different perspectives. So it's a useful model that I know students still very much refer to in their academic work. I would be less sure how much it is used currently in practice, but you can see some of the mirroring of the new policy that has been outlined by Susan, having those domains, particularly that, you know, professional and personal aspect of what supervision needs to be. So could I have the next slide? So in our review of the literature, we asked a few questions. What does best practice for social work look like? Why doesn't supervision happen, and what to do to make it happen if it isn't happening, and how supervision impacts social workers' well-being and the service users' outcome. So there's a direct line between supporting the well-being of your staff and the supporting the standards of practice as well. So next slide, please, Susan. So some of the barriers to reflective supervision is whenever supervision can become very resource intense, and that's that managerial function that you know, if resources are particularly strained, it can become all about the resources, and the other important parts of supervision can be lost. So also another barrier is whenever supervision fails to acknowledge, you know, the effective impact, so the emotional impact of the job on social workers, and the kind of autonomy, you know, that they feel they have or they haven't. Another one Jill Manthorpe refers to is that sometimes reflection and supervision might be seen as an optional extra, like a luxury, rather than something that is built in. And they found that in research, even with newly qualified social workers. Also a concern and a barrier is around the limitations of supervision training for social work managers, and therefore, you know, the confidence of managers to maybe dig that bit deeper sometimes with a member of staff. So that can become another barrier to good reflective supervision. Next slide, please, Susan. So, and that enablers of good reflective supervision is when managers are seen as facilitators of reflective practice, and that they're committed to that reflection, that professional reflection within supervision. Also, as Anya was saying earlier, that relationship aspect. So good relationship between the supervisor and social worker is critical to the success of that interactional supervisory process. And so that we're talking here about levels of trust that is, you know, can be developed within the relationship that needs to be present for reflective supervision to be effective. Had also talked about that flexibility, and it's great to see that echoed across the policy here. You know, that need for supervision, you know, isn't just about our standard monthly meeting. It's also about that ability to have some support around the group supervision, but also the open door policy, where people need guidance and advice on their toes, as it were. So that's another benefit. Relationship-based supervision and resilience. So we know that positive relationships between managers and supervisors supports resilience and is a buffer to burnout. So relationships is key to our practice as social workers. It's also key to our relationships with supervisors and managers. Protected time and space is needed for this. Sorry, there's somebody speaking. Protected time and space needed to support managers and social workers in that reflective supervisory practice. So uninterrupted time is really key there. Obviously, pressures on managers' times can detract from protected time. You know, if there's a crisis, if there's something going on that a manager needs to reschedule or interrupt, and that can be problematic, as we know. Managers need supported to be able to support social workers. So it's great to see built into this policy the level of supervision required for managers themselves, because that's so important. If managers aren't supported, they aren't able to really hold and support the frontline social workers. And there's systemic rewards from reflective supportive supervision, because it's the impact on the service user, the impact on social workers, on managers, and the wider organisation and the profession. So another slide there. Thanks, Susan. So just some of the benefits for social workers that we found in the literature. They found that it was, you know, positive and constructive challenge, you know, to their thinking and their practice, and gave them space to reflect. They felt that it was supportive, enabled discussion safely, found it really helped them to engage in their practice and build their confidence. It helped them to process the emotional aspect of the job that otherwise they were left sitting with. The next slide there, Susan. And the benefits to service users is about well-being, their safety, better service, more productive service, and it supports the practitioner and therefore supports the service user. So there's that through line between good, you know, reflective supervision and how that can impact then on the end service user experience. Next slide there, Susan. So in summary, the reflective supervision in social work, the main finding is supportive, available manager or peer group supervision enables reflective practice and gives space to people to slow down and pace their thinking. Regularity of supervisory sessions and acknowledgement of a social worker's autonomy are seen as great and powerful enablers of reflexivity. In contrast, task-orientated approaches to supervision that overly focuses on accountability and resources, hindered by the sparsity of resources, is problematic both for the social workers and the service users and the wider managers and organisations. So next slide there, Susan. So that is my little contribution today. So thank you.
Select the microphone.
Sorry. Okay. That's me finished. Thank you, Susan. I'm handing over now to Maria Emilsson.
Thanks, Paula, and thank you for being here. My name is Maria Emilsson. I work for the Learning Development Governance team in the Western Trust, and it's such a delight, specifically for me, who have been part of this process from the beginning, to see this being launched today. So I'm so excited about it. I'm going to talk a bit about value. Sorry, just go back a wee bit around group and peer supervision. But before I do, I just want to acknowledge, Susan mentioned around this is now going to be going out into the trust. And part of my role has also been to chair the regional group of trainers who deliver the supervision training at trusts. And I just want to acknowledge their input because they have been fabulous in their expertise, experience, and eye for detail from practice and from their experience of talking to line managers and supervisors and contributing with their feedback. And we're also working on the e-learning that hopefully will be ready in a couple of months' time. So thank you. So yes, so next. So group and peer supervision. So I'm going back a bit to the survey that Aine mentioned. And one of the questions in that survey to supervisee was around where else do you go and get your support from? And as you could see, the top two bars, there's, I think it's 91%, it's very small on my screen, so I can't see the exact numbers, in terms of conversation with colleagues and then conversations with other professionals is very large too. But then when we look at peer supervision and group supervision, that's very small. So there's something in this where it kind of wasn't seen within the system we had under the old policy as a really important part of supporting practitioners, both as part of their development, but also as part of their well-being and resilience in delivering to service users the great job they do. So this policy, if you click a little forward, please, is therefore, as Aine and Susan both were talking about, really taking the opportunity to create a space for flexible practice, where we can utilize different ways of supporting staff and where group and peer supervision can become part of that, as opposed to just being an added extra that people were struggling to find place for. So hopefully what I'm going to do in the next 10 minutes is just literally put out some pointers to why this will be really important and valuable to consider as you're going into your teams and services and looking at your supervision plan. So next slide, please. So no one knows as much as all of us. So really, when we're starting to think in groups, we are more than the sum of our parts. There is something in that process that creates an added benefit and an added contribution. But there is a slight difference between group and peer supervision. And the group supervision requires a facilitator led with a more formal structure, and that can be about development, but it could also be about clinical consultation. It could be about case decisions and reflecting on people's practice. The peer supervision is more democratically led. There's no hierarchical, there's no lead. It often kind of alternates in terms of who takes charge in that, although it still needs to have a structure and with a particular clear goal about what's going to be achieved through that to sort of achieve for people who are joining in. So just a slight difference. Yeah, please go forward. And I think one of the things in preparing for this was reflecting on why is it that we're not doing it so much? And I guess there is a challenge for supervisors and facilitators of group supervision in facilitating group, because it's not always straightforward, and it's managing the dynamics within that group. It's keeping an eye on the goal. It's about understanding what's going on for people outside of the group. And I think one of the things that stands out for me that is important to keep hold of is a quote from Nancy Klein, who has written a lot of books and done a lot of research and teaching around how we support people to become independent, critical thinkers that can contribute in a helpful way. And what she says is that the quality of everything we do depends on the quality of the thinking we do first. And the quality of our thinking depends on the way we treat each other while we're thinking. So there are some non-negotiables around setting up and working within groups, whether that will be group supervision or peer supervision. And the first one is really the importance of establishing psychological safety and trust, that it is safe for participants to be seen as at any time and place, they're doing the best they can, and it's okay to make mistakes. It's a vulnerable place, and it's a courageous choice when we start talking about aspects of our practice that may not be 100% okay, or may feel that we might be vulnerable to be criticized for. So to creating that psychological safety and trust is really important. And then for the process to be effective, we need to have some agreed rules of engagement. And again, it's that kind of legwork we have to put in from the beginning about how we establish that within the group as part of a group agreement. And the policy have some templates at the end of it in terms of the importance of establishing those when we start setting up group supervision or peer supervision processes. What can also be helpful is to have the structure, and Susan talked about, you know, there's some very sort of models of supervision and the standards that needs to be met. There needs to be a sense of predictability so people can engage in the process knowing what comes next, and that it's a safe space. But equally so that we're mindful that it doesn't become constraining, that the structure doesn't start to take away so much from the goal of it, that it actually it becomes barriers for people's engagement and taking part. And then having that shared goal that people, when we come together as social workers as part of these group processes, that we understand what we're aiming to achieve as part of that discussion, to keep on target, to stay focused on how we try to do that, but also to be able to reflect and evaluate if we're not achieving our goals, what do we need to change? What do we need to do slightly different? And in that way, we start generate buy-in and being purposeful. So next slide, please. So why do it? What's the gain? Why not just stick with the individual and keep it simple? So I'm going to try and pull out some core ideas that has come from research and align those to the functions of supervision that we have in the policy. So the professional development is the core benefit of doing group supervision. In a group or a peer setting, we experience different perspectives, different viewpoints. We are exposed to, in subtle and nice ways, how diversity of experience and background and approach can influence both how we see a particular situation, how we might use our knowledge to understand it, and then as social workers, what we do with that understanding in terms of intervention. There's also thinking that happens between group members. So as one person speaks, it starts to shape and direct and alter how another person may think about a problem. And that adds an extra value. And it supports curiosity. So why is it that you think that way and I don't? What is happening for you that I'm not seeing? And that helps us to then explore and reflect, as Paula was talking in her slides, around the importance of reflective practice, of having that curiosity. And time to think and think aloud and reflect collectively. When we think in our own headspace, we're limited by the cognition of our brain. But once we start putting what goes on internally to the external in words, we create a different understanding on what we're hearing. And it allows us to consider different options, you know, and even practice sitting back and just listening. We as social workers pride ourselves on our listening skills, but once we start doing them, we find that it's not always that easy. And it promotes emotional intelligence. It promotes our ability to contain ourselves, to contain others, to listen to others, to be mindful of the room, read the room, and understand our context that we're operating in. So those are some of the benefits of doing things in a group from the professional development function. If you can go to the next slide. So then the personal function. Shared experience and empathy, I think, is one of the core. In some of the work I've done with teams is that we talk often about self-care, and I wish we could move a little bit towards team care, that actually caring and containing each other and supporting each other is something that really supports resilience. And Paula talked about the relationship between supervisor and supervisee, and that also goes out to relationships between team members and how we support each other. And we're often kinder and more understanding to others' flaws than we are to our own. We most of us suffer from some level of higher criticism of ourselves than what we do of others. So by hearing somebody else having an issue or finding something a difficulty that we might ourselves have also experienced may support us to become more kinder and more compassionate towards ourselves. And I think one of the biggest thing is the realization that I'm not on my own. And I think that specifically is the supportive element for newly qualified social workers who are still trying to find their social work identity, knowing where they are practicing, and what they're experiencing is not a reflective individual flaw, but actually a kind of a output of the difficult, challenging situations we face as social workers and how we get around those. And then the holding and containing, feelings together and shaping collective hope, that if one person in a group has a belief that the future can be better than today, and you have the power to make it so, which comes from Chan Hellman's definition of hope, it is very likely that that will spread in the team and be shared by other people as well as part of that group. Okay. And then the organizational function. So as we're battling with different cases or discussing issues affecting the team, that can definitely, add another layer of creativity, thinking outside the box, promote team working, how we can help each other to meet our goals of the service. And also as part of that policy around meeting statutory functions, that often it is not one person in the teams who may be struggling to meet statutory function. It might be systems located issue that is creating that difficulty. And as a team, as a group supervision, the thinking caps can go on and start working around that. And then informed decision making. So we talked about consultations and case and clinical discussions. We know from science of safety, we have a supervision model that case maps a case in a group and actually uses the resources within the group to think about what's going on and how to take that forward. It could also be helpful for group work or group care settings where more than one professional is involved with one particular service user receiving the service, to give a different perspective around what's going on for them and how we can best support and promote change. So next slide. Coming to the end. So the 4 C's, Bridget Proctor, who's written a lot around group supervision, talks about the 4 C's, that when we are able to do good and effective group or peer supervision, what we add to practitioners' experience is confidence in themselves and in their practice, competency, compassion, and creativity. And Bridget in her work found that where people were using effective group or peer supervision, they became more effective in using the individual supervision as well. Now, when I was looking into this for the presentation and I was Googling 4 C's because I've seen Bridget's Proctor, there was another 4 C's that came up, if you want to click forward, Susan. And they come to education. And I thought, actually, this fits with group and peer supervision as well, that when we are doing this work, we're improving and enhancing our communication. We become better at communicating with each other in terms of listening. We improve our ability to collaborate and to apply critical thinking and creativity to our practice and to our casework. So there's an additional 4 C's that I would like to include in that. And then finally, so people, teams, and organizations are more productive and effective and innovative when they regularly take time out to reflect, learn, and adapt. And as Paula highlighted from her research, is that in the individual supervision, and we found this in the survey, which kind of promoted this flexible approach in this new supervision policy, was that the management function or the organizational function often took precedency because of the business of the work and needing to get an oversight of what was happening at the cost possibly of a bit of reflection and learning and adapting. Now, in group and peers, it is harder to stay focused on just the organizational, what has to be done, because you have a group of people who adds their thoughts and views and ideas, and you, as a human being, it's very difficult not to reflect on what is being said and what has happened. So it supports a very natural and nice way of touching back with reflecting and learning and working as a team. So thank you. That's me finished.
Thank you very much, Maria. That was really interesting. Good afternoon, everybody. My name is Marion O'Rourke. I'm the Director of Regulation and Standards with the Social Care Council. And for those of you who are watching the clock, I'm not going to talk very long. But before I do say what I want to talk about, I want to say firstly that I'm so delighted to see so many people here this afternoon for the launch of this really important policy for social work in Northern Ireland. And like Aine, I want to take the opportunity to thank and pay tribute to all of the social workers who have helped develop and shape the policy. So thank you. Next slide, please. So you will see as part of the policy, we want you, when you get to look at the policy, you'll see that we want you to think about the importance of leadership and to connect with the social work leadership framework. Now, I appreciate that this framework is not necessarily well known at this stage across the profession, but it will become accessible on the Council's website, and we will distribute it widely at a future point. We're really at a stage of looking at how to bring it forward and how to land it. The leadership framework will help us to recognise and value and support leadership at all levels, or perhaps in recent conversations we've been having about leadership, a better way to describe this is the concept of distributed leadership, so that leadership doesn't really sit with or is held on to by any one person, but that we all have a responsibility to lead in a variety of ways. And that's important when thinking about how we strengthen our professional identity, having a focus on what leadership means within the supervisory conversation, and how how that conversation opens up the opportunity to talk about leadership and to talk about what that means in terms of social work as a profession and what our identity is. So the framework will therefore provide a sense of direction and focus for this, and hopefully we will see that this is an approach and focus in supervision that will help leadership to thrive and flourish, really. Next slide. So I'm not going to speak at any length to this slide. I want to leave it with you really to explore for yourselves, as this is the essence of what the leadership framework, with its 4 domains of leading self, leading practice, leading with others, and leading the profession. That's the essence of what the framework looks like. And hopefully when you get the opportunity to look at, you will see that that it provides a direction for you really to take a deep dive into particular aspects that will allow the person in the supervision session with you to explore their leadership from different lenses, and indeed what that means within whatever context you are working with. Next slide, please. So I know that you will all already have, those of you involved in supervision, that you'll have a portfolio of tools that you like and use on an ongoing basis in supervision, whether you are the supervisor or the supervisee, and hopefully you are both. We all should be experiencing that from both directions. or indeed in a group scenario, as we've talked about this afternoon. I'm hoping that the leadership framework will support you in implementing the supervision policy in a way that makes sense to you, and makes sense and strengthens what you already do. I'm suggesting to you that thinking about leadership, and maybe using the framework as a tool will, hopefully you'll find that useful when considering, what you want to plan or focus or structure within that supervisory context. At the council here, we're keen to work in partnership in landing good usage of the leadership framework, and we've been having lots of conversations about this, but haven't got to the stage yet of issuing any guidance around the framework yet. But in fact, the supervision policy is a great example of how the leadership framework could be used. A place where we as a profession are making making good connections, I suppose, across policy and strategy and frameworks to have a consistent approach, and a high quality standard to all that we do, and in this particular case in relation to professional supervision. So I'm putting an offer out to you, I suppose, that if you haven't already been part of any of the conversations around the leadership framework, then come and help us explore how leadership can and a framework around leadership can support you, and support all of us as a profession, and support the delivery of good quality practice, and support good quality supervision. So if you're interested, do please feel free just to contact me directly, and we can connect you into that. I'm going to hand back now to Susan to give us an overview of the next steps for the policy in terms of getting it out there. So over to you, Susan.
Thank you. I'm trying to, every so often these slides decide they don't want to move on. So I do have another slide to go. There we go. So just in terms of what happens next, service supervision plans will be completed in your service areas, and that will be with the support of governance leads. One thing I'm just noting is that there have been a few comments in the chat which I haven't had the opportunity to look at. Can I just suggest that if you do have any queries, that you take them back and have those discussions within your organisation? And I have said to those governance leads that I'm happy to have further conversations with them if there are queries coming from yourselves. So that's what I would suggest, but I will take a look at the chat after this is over. What you'll find is that there'll be new formats for supervision agreements, which the policy contains, and that you'll also find that the way individual supervision is recorded will be slightly different. You will also have a new experience, possibly, of what supervision looks like, because you may have traditionally experienced one-to-one line manager supervision, and you may get the opportunity now to move into a form of group supervision or utilize those consultations with senior or principal practitioners that we spoke about earlier. And I think key to it all is that there will be training available for supervisees and supervisors in the coming year. And I know that all the learning and development teams are planning for that. And it's just that we would encourage you to, Maria had talked about for supervisees, the learning when that becomes available to complete that, and that supervisors engage in really understanding how they can use this policy to help them deliver good quality supervision. So they're the sort of next steps. And we've done very well in terms of our timekeeping. We wanted to finish at 1:15 and we're getting very close to it. I want to thank everybody who attended today. We hope that you like what you heard and that you are as excited as we are about the new opportunities this policy is going to be able to avail you of for supervision. And can I thank everybody who contributed today, all the speakers, that it was really, really helpful and really interesting. And can I also thank NISC for hosting this today for us as well, the seminar. And as Alison said at the beginning, the recording will be available and we will be sending out the presentation and a copy of the policy to everybody who attended over the coming week or so. So that's it from me, and can I just thank everybody once again, and we hope you enjoyed the seminar.